Welcome back, Careblazers. In today's video, I want to talk about a brain condition that can develop into dementia. It's called Chronic Traumatic Encephalopathy, or CTE for short. And over the recent years, we've been hearing more and more about this condition. Initially, we really only heard about it when it came to boxers, but now we hear about it a lot for military personnel and football players. And what chronic traumatic encephalopathy is basically a condition that results from repeated head trauma. So basically, somebody's brain has been beaten up quite a bit to the point where it negatively impacts their overall functioning, their thinking, their behavior, and their overall quality of life. So when you think about boxers, they get hit in the head a lot. A lot of times people in the military have a lot of concussions and head injuries. Same thing with football players, but this can happen to anybody. Let's get a better understanding of how CTE and Alzheimer's disease are similar, but also different. When somebody suffers a concussion, they can recover fully from that concussion. But with CTE, it's repeated head injuries over and over. There's some key aspects basically to keep in mind for CTE. Number one, it is a progressive condition, meaning it will get worse with time. It negatively impacts brain functioning, and it can happen to any kind of individual who has repeated head injury. It's not only to a single sport or a single profession. Typically, CTE happens and forms years after the initial injuries. So somebody could have had multiple repeated head injuries, and in years' time down the road, they start to develop CTE. It's not necessarily in the moment when the head injuries happen. Now, CTE can look different from person to person, but it generally falls into two different categories. One category is called the behavioral variant or the mood variant. This typically happens to somebody who is younger, and the initial symptoms tend to be aggression, depression, and irritability. Also impulsivity. In this behavior variant, it can later on progress to more cognitive or thinking symptoms, but not always. So that's the first kind of variant for CTE. The second kind is the more cognitive variant. And in this kind, it typically has a later age of onset, and the initial symptoms happen to be more cognitive, like memory loss, difficulty initiating tasks, basically executive functioning impairment. And this type is the type that is more likely to develop into dementia. Now, it can be really difficult to recognize that CTE is actually present. You can't technically confirm it until after somebody's death. There's still a lot of research happening in this area, trying to identify potential biomarkers and coming up with different techniques to be able to more accurately diagnose CTE. Now, because there are a lot of overlapping symptoms with dementia, it's really hard sometimes for providers to figure out, is this CTE or is this a type of dementia? We have symptoms like memory loss, irritability, depression, difficulty with executive functioning, attention difficulties. So lots of similarities to many of the dementias. Many times for CTE, the symptoms tend to emerge much earlier, like in somebody's 30s or 40s, whereas in Alzheimer's disease, although it can start earlier, it tends to typically happen after the age of 60. Unfortunately, just like with Alzheimer's disease, there is no cure once somebody develops CTE, and most of the focus is really on prevention. Specifically, how do we prevent repeated head trauma? So in sports, it's really about using protective equipment like helmets, implementing and following stricter concussion protocols in sports. So once somebody has a concussion, following strict guidelines to help determine when they're okay to return back to play. Also, truly educating the athletes, the players, military personnel on the risks about concussion and potential long-term consequences of repeated head injuries. Chronic traumatic encephalopathy is a significant health concern for the public, especially those who are in positions, sports, occupations that are more likely or at higher risk to have repeated head trauma. Hopefully, we'll know more as more and more research happens, but I thought this was just a good video to inform everybody that CTE can develop into dementia down the line, but it is a separate condition. There's lots of similarities, which makes it really hard to differentiate which is which. And if your loved one is somebody who has had a lot of repeated head injuries in their past, this could be something that they have. As always, you want to check with their doctor and ask all the questions you need to get more specific feedback and guidance on your particular situation. Careblazers, I'm sending you so much love. I hope this video was helpful. If you ever have a video idea or question or topic you want me to answer, all you ever have to do is write it below in a comment to this video. We do read all of the comments, and we do keep a running list of video topic requests. All right, I'll be back next week, as always, with a new video. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.